Thank you for the opportunity to present at this international conference. My name is Martin Chai, one of the faculty in radiation therapy at the Michener Institute of Education at UHN in Toronto. The title of our group submission is Mobilizing the Troops, Moving Clinical Simulation Online. In this presentation, I will be addressing the following objectives: a high-level overview of the radiation therapy program within our medical radiation sciences program, the traditional structure of the radiation therapy clinical simulation semester, how, in response to COVID-19, we were able to restructure the clinical simulation semester to run completely in a virtual format, and what lessons we have learned so far and what we see looking ahead. For over 20 years, the Faculty of Medicine at the University of Toronto and the Michener Institute of Education at University Health Network have offered a joint Bachelor of Science and Advanced Diploma program in medical radiation sciences. Students coming into our 3-year program are admitted directly into one of 3 disciplines: nuclear medicine and molecular imaging technology, radiological technology, or radiation therapy. Our students participate in simulation throughout the didactic semesters that culminates in a 12-week preclinical course that we call the Clinical Simulation Course or Clinical Simulation Semester. This occurs between years 2 and 3. During the semester, students consolidate their learning across 3 radiotherapy streams: patient care and communication, that included the use of standardized patient actors; treatment planning, where students created plans in our Exio lab; and treatment delivery, where students practice methodology on our cold Electa-Linac simulators. Our simulators do not produce MV X-rays, but are fully functional in all other ways. With the outbreak of COVID-19, our program only had a few weeks to convert our course from the traditional physical environment to a virtual environment. Our main goal was to try to maintain the course's intended competencies and learning objectives as best as possible while providing an engaging learning experience for our students. While our program is very familiar with teaching and learning online, the format of this course is completely new and unlike anything we've done before. Here's what we're doing now. In patient care, the format of the sessions has been maintained, but patient communication and assessment take place online. We use Blackboard Collaborate as the online platform for patient communication, as it allows video conferencing for larger student groups, as well as allowing for individual breakout rooms like for one-on-one student and standardized patient interactions. Students receive feedback from peer, faculty, and our standardized patients. The nature of our patient care assessments was generally unchanged from before. In the treatment planning stream, students were granted remote access to our computer servers so that students could work remotely on their plans. Technical support was provided to each student prior to the start of the stream in order to ensure software and hardware compatibility. Blackboard Collaborate is used for informal consultation with peer, as well as for our more formal plan reviews that occur with faculty. The move towards online planning has allowed students increased accessibility to the treatment planning system and the ability to work with peer and faculty in real time. Of the 3 streams, the pivot to virtual learning and treatment delivery proved to be the most challenging. We have placed greater emphasis on case studies, focusing more on the rationale for radiation medicine decisions with a reduced skills component. During our session with students, we analyzed case studies by integrating the principles and practices of radiation therapy. GoToMeeting is used as the online collaboration platform for treatment delivery, as it offers students the ability to take remote control of software presented by faculty. We use the virtual environment radiation therapy VIRT software to complement the case study. VIRT provides students the opportunity to perform basic machine and patient setups, but also to visually review cross-sectional anatomy, critique treatment volumes in 3D, examine doses to various volumes, and discuss target coverage and organs at risk. VIRT helps students to foster problem-solving and critical thinking skills through manipulation of both the machine and the patient in a safe online environment. In VIRT, students can perform image-guided radiation therapy like cone beam CT with image matching for field verification. In treatment delivery, our online OSCEs pair students to work together as a team, and they are evaluated on their case analysis, technique, critical thinking, communication, and scope of practice. For the lessons learned and looking ahead, there are some notable items. The course's objectives focused on principles and overall outcomes rather than use of technology or buttonology, which made the objectives still applicable to an online learning environment. Our clinical simulation semester is still in progress and has yet to be formally evaluated, but we are encouraged by the anecdotal student feedback, which has been very positive so far. The technologies and softwares we have employed generally work well, but with technology can sometimes be quirky to deal with. The challenges we experienced include the transition to a virtual format requiring training on new software, development of some new content, and determining the most suitable learning technologies that we had on hand. For treatment delivery, students will not have the same level of physical skills compared to previous cohorts, but we are hoping that they will have a stronger set of critical thinking skills. Looking ahead, the clinical simulation course is being used as a testing ground or proof of concept that will provide us with valuable guidance when preparing for the fall semester when all of our courses will start online. Here is the radiation therapy team, faculty, academic chair, and from all of us to all of you, keep calm and virtually carry on. Now for questions and answers with Robert Case. Thank you.